Dr. Dusty here. So today I'm going to go over some more information with regards to chiropractic care in your shoulder. There's various conditions that a person can have with their shoulder. First off is the AC joint separation. That's where the clavicle and the acromion process of the shoulder blade actually separate. And in most cases, the clavicle will kind of raise up and separate away from the joint itself. So that's the AC joint separation. Then you have some arthritis or an arthritic condition. What happens here many times is the AC joint will get arthritic, or the humerus as it comes into the scapula, or the glenohumeral joint will get arthritic. And so people begin to have kind of grinding sensations and pain in the shoulder and can't move it the way they used to. A bursitis or a tendonitis, that's just where the bursa sac, which protects the tendon from the bone, gets inflamed or displaced and inflamed. And it creates a tendonitis situation that can be pretty painful. Person can't move their shoulder the way they'd want to. Then you have the frozen shoulder, which these actually can all kind of relate: arthritis, bursitis, tendonitis, frozen shoulder. Basically, frozen shoulder is where the capsule surrounding the joint gets really inflamed and it develops some fibrotic tissue, and this person cannot raise their arm very well. That's kind of a frozen shoulder type of a situation where you really got to work on the mobility of the shoulder to improve their ability to move it and do what they need to do during the day. So frozen shoulder, also known as adhesive capsulitis, very painful situation and condition, and responds very well to chiropractic adjustments and moving that shoulder. Then you have rotator cuff muscle tears. And so the rotator cuff muscles, the sits muscles, and I've discussed those in a previous video. You have the supraspinatus, the infraspinatus, the teres minor, and the subscapularis. Those are the sits muscles. And the one that's probably most frequently injured would be the supraspinatus muscle. Patients can get tears in that, and in some cases, those have to be surgically repaired. Not all, but some. So those are some of the conditions that a person gets with their shoulder, or can get with their shoulder. Now, the other problem that arises, and many times, unless a person has a direct impact to the shoulder, like get involved in a slip and fall, or an auto accident, or some other situation where their shoulder gets jammed and injures the rotator cuff muscles, or injures the joints, or separates the shoulder, or whatever, is you get a pinched nerve in your neck. So this pinching can cause abnormal nerve supply into the muscles, into the rotator cuff muscles. It can cause abnormal nerve supply into the joints. And as a result of that, it can cause abnormal motion of the shoulder and start to create some of these conditions like arthritis or bursitis or tendonitis, a frozen shoulder. Or it can make a situation where a rotator cuff muscle tears can occur much more easily. So if a person has, or if you have shoulder problems, it'd be a good idea to get it checked out by a chiropractor, because you really want to kind of trace it back and look at that neck and see if there's any involvement of the neck that relates to the problems that you might be having with the shoulder. All right. So many times there's so much pain in the shoulder, you don't even know you have a neck pain or neck problem until you actually get it checked out by a chiropractor. All right, so there you go. My contact information is below. If you have any questions about your shoulder problems, or if you know somebody that has a shoulder problem, please pass this video along to them.